Thank you, Mr. Chairman, and Senator DeRosso. Welcome to the dais. Is this your first bill?
Yes, sir.
Presenting?
Yes.
You presented it well. Congratulations, and
Thank you.
appreciate your presentation, and I appreciate so many people that have come out. Forgive me because I'm kind of losing my voice, which many on the other side of the aisle probably like that, but you're seeing democracy in action here today. So, and it's a wonderful experiment. I've been in the legislature now for 4 years and starting my second term, and one of my issues, big issues in the state, has been with the Medi-Cal program. That during the 2008-2009 recession, we gave significant cuts to the program, 10%, that have not been fully reinstated. We've had some proposition money that's been backfilling. But the bottom line is that we don't have enough physicians that will participate in the Medi-Cal program, putting managed care aside, because we just don't pay an appropriate fee for them to participate. And so the California State Auditor just released a report. It was just this last week. Millions of children in the Medi-Cal program are not receiving preventative health services. And I know that the chairman understands this, being an esteemed pediatrician. An annual average of 2.4 million children who are enrolled in the Medi-Cal over the past 5 years have not received all of the preventative health services that the state is committed to provide them. The Centers for Disease Control and Prevention provide children with an annual preventative health services, saves thousands of lives, and reduces future health costs by the thousands of dollars per child. So one of my concerns, Senator, is that we have a system of healthcare delivery that has been broken, that has not been delivering the services that have been promised to the beneficiaries as they exist today. By including this population, we are going to be adding a significant number of people to the Medi-Cal rolls. At significant expense. I know there's been no amount of money that this is going to cost in your bill, but I believe it's in excess of $2 billion to provide all undocumented with Medi-Cal services, and you can correct me certainly if I'm wrong. But by adding this number of people to the existing roles that are going to be seen by the few physicians that we have, it's going to even further dilute the availability of physicians to see people that are in the system today. So the first question is, what do you think we need to do to get the Medi-Cal system in shape so that we can really say that it is healthy to accept more patients, number one? Number two, do you have any idea if you're going to cap the number of people that are going to be enrolled in this program, or are you going to cap the amount of expenditure in this program? Because I'm going to suggest and opine that if we pass this and the governor signs it, as he has indicated that he probably will, that I would imagine that we are going to see more immigrants coming into California to seek the services that, so we don't hear some of the terrible stories that we've seen. So I appreciate if you can answer those questions.
Sure. Well, let me just start with the last one. I've spent most of my adult life with immigrant families and immigrant workers. And I can assure you that the reason they come to this country is not for the health care. That is not what drives them. What drives them is what pushes them out of their respective countries. Mm. They live in absolute life and death poverty. That is why they risk their lives. That is why hundreds die each year crossing the border. Mm-hmm. So that kind of clarity, or they face enormous violence in which they can, every day, members of their families, friends, and neighbors are getting killed because of the violence. So I assure you, after many decades in this community, that health insurance or having a driver's license or anything like that has nothing to do with what drives them. They would prefer to stay in their home countries. Mm-hmm. With regards to, I'm not yet an expert on Medi-Cal, so I couldn't pretend to answer some of your questions, and there may be others here. But I would say what we're looking for is an efficient system that gives health care to all in such a way that we don't have to resort to only emergency services. I think we should get more of those numbers, maybe, for me to really back that up. But I know, having been involved with healthcare plans for over decades, that it is not efficient, and we always had to negotiate with the providers to say, keep people away from the emergency room because the cost is so high. And right now, what we're doing is we're pushing them to the emergency rooms. We're still paying, Californians are paying for those emergency room services. We're paying for last-minute visits. So it's not like they're there and we're not putting out any money right now. We're paying. Question for us is, do we have a smarter plan to cover them and to give them the attention? If we do not give it, it's not just the individual family members who suffer, but imagine the prevention of diabetes, the prevention of respiratory ailments. There's so many things that cost us billions. I can guarantee you billions of dollars. So when are we going to get smarter about thinking that somehow we're saving money when in fact we're spending more? So I'm sorry, I don't have the exact numbers for you, and we'll work on it. Maybe there's someone here who can provide that. But that's the way I've seen it, and that's how that's been my experience my whole life.
I appreciate your answers, and I appreciate your compassion, and I appreciate your passion for what you're trying to accomplish here today. I'm unfortunately not going to be able to support the bill today, and let me explain why. It's not that I don't believe we are not a compassionate state. I think we are a compassionate state. When I use my personal money, I donate to causes that help undocumented people in my district. But we're talking now about taxpayer money. And usually when you look at bills, you have to make a nexus to the budget of the state. And so this is going to be a very expensive law, in excess of $2 billion, maybe more, as you probably said. So it basically comes to a matter of prioritization in the state budget. And we are a state that has some significant issues. We have a significant homeless issue. We have roughly 180,000 homeless people in the state of California, probably more than any other state per capita. We have veterans that are in dire need of help. We have senior citizens that are struggling to stay in their homes. So as we look at bills like this, we got to take it into the context of prioritizing the needs of the state. And if money was limitless, I would be joining you 100%. But money is not limitless. It is finite. And based on the numbers that are coming into the state coffers these days, we're seeing maybe a downward trend in our projections. So, and that will limit what our spending can be. But I think that these other needs and our children, we want to provide early childhood education. All these programs have price tags. And I think, in my mind, those have the priority right now for those citizens that are here that are documented. And then when we have the kind of money that we can afford to take care of other populations in philanthropic and charitable ways, I'm 100% behind it. But at this point in time, I've got to address the problems that we have in the state that we're having trouble funding these days. But I appreciate your passion and you bringing the bill forward.